Hi, my name is Tiffany Wade, and I'm a family nurse practitioner student at Auburn, and this is my video on phenothiazines. I'm sorry we're in the closet, but I keep hearing them outside of my window. I know they're trying to listen and watch me, so there's no windows in here, and also I'm closer to the bathroom. I've had some nausea and vomiting. Hopefully that won't affect this video. And I'm sorry for those hiccups. My husband's had them for a few days, but he's walking away now, so that shouldn't bother us anymore. But back to phenothiazines, you have your chlorpromazine, your perfenazine, your prochlorperazine, your promethazine, your thuridazine, your fluphenazine, and your trifluoperazine. All of these drugs do alter the effects of dopamine in the CNS, and they all possess significant anticholinergic and alpha-adrenergic blocking activity. Therapeutic effects include decreasing the signs and symptoms of psychosis, nausea, vomiting, and intractable hiccups. For the antipsychotics in this group, they block dopamine receptors in the basal ganglia, hypothalamus, limbic system, and the medulla, and they help reduce the positive symptoms of schizophrenia, which includes your hallucinations, delusions, and racing thoughts. For the antiemetics, they block dopamine receptors in the chemoreceptor trigger zone, which helps with the nausea and vomiting. All of these drugs are absorbed rapidly and widely distributed into adipose tissue. They do cross the blood-brain barrier and placenta and enters breast milk. They're highly metabolized by the liver, and they're excreted in urine and some through intrahepatic circulation. Precautions: you have to look for those extrapyramidal symptoms, which include your dystonia, your akathisia, your tardive dyskinesia, and your Parkinsonianism. And also with the antiemetics, you have to look for respiratory impairment. It can actually suppress the cough reflex and cause aspiration and silent pneumonia. And all children are more prone to develop EPS reactions, and this is a pregnancy category C. Contraindications: do not use in Parkinson's, narrow angle glaucoma, bone marrow suppression, or severe hepatic and cardiovascular disease. Promethazine has a black box warning with children less than 2 years of age because of fatal respiratory depression, and also all antipsychotics have a black box warning with use in the elderly when using with dementia-related psychosis because of increased mortality rates. Adverse reactions include drowsiness, sedation, those EPS symptoms, orthostatic hypotension, pink and reddish-brown urine, agranulocytosis, your anticholinergic effects, dry mouth, urinary retention, and your increased prolactin levels that can actually cause amenorrhea, galactorrhea, gynecomastia, and a life-threatening adverse reaction is neuroleptic malignant syndrome. That is when you have an elevated fever, diaphoresis, increased heart rate, respirations, your muscles will be rigid, and altered mental status. Drug interactions: you'll have added CNS depression and anticholinergic effects with any drugs that already do those effects. Your antithyroid drugs may actually increase the risk for agranulocytosis. With antihypertensive and alcohol and phenothiazines, you have to watch for hypotension. And with lithium, phenothiazines can actually increase the risk of EPS, and phenothiazines can actually mask the signs of lithium toxicity. For the indications and clinical use, all P's in this group can actually treat nausea, vomiting. Your perfenazine actually treats all three. So hiccups, nausea, vomiting, and psychosis. These antipsychotics are more effective at reducing the positive symptoms of schizophrenia and treating severe psychosis in atypical antipsychotics. And chlorpromazine is actually the drug of choice for hiccups, and it provides rapid sedation. So the phenothiazines are a good first choice for initial and short-term use of nausea or treatment of nausea, except in children. And for the antipsychotics, you're going to have to look at past response, initial response. They do have low potency and high potency when you're doing drug selection. You do need to monitor CBC just to look for agranulocytosis. You also need to monitor for consequences of the increased prolactin. You also need to look at AIMS, which is Abnormal Involuntary Movement Scale Checklist, and that will help detect early signs and symptoms of those EPS symptoms. Education: avoid sudden withdrawal. Take as prescribed. Report signs and symptoms of neuroleptic malignant syndrome or EPS. Avoid alcohol or CNS depressants. Also avoid driving until you know how the drug is going to affect you. Let them know it might turn their urine a funny color. Maintain good oral hygiene. Drink plenty of water because of the anticholinergic effects. And now to the main takeaways. They all end in azine, so that's going to help you identify them. They have three main uses: to treat psychosis and the positive symptoms of schizophrenia, also to treat hiccups and nausea, vomiting, hence that craziness at the beginning of this video to try to help you remember. Also remember the black box warnings: promethazine with children less than 2, and then all antipsychotics in the elderly. I've also tried to come up with something called DAPNA, D-A-P-N-A. So phenothiazines, DAPNA, you have your dopamine, anticholinergic, your prolactin levels, neuroleptic malignant syndrome, and your alpha adrenergic blocking activity to try to help you remember it. And also, all the antipsychotics in this class are actually used as second-line defense for treatment for schizophrenia and psychosis after failure with the atypical antipsychotics because of all their adverse reactions. So that's the end of the video. Hopefully it helps y'all remember phenothiazines.